Hello friends, I'm Dr. Amit Oswal. I'm back with another video. So topic for today is, will a dental filling be painful? This is a concern which is asked by many patients and which is asked by many people who want to get a dental filling or who want to look for a dental filling for their kids or their relatives. So what is their answer? We'll find out in this video. So let's start with the video. First and foremost, we need to understand what is a dental filling. A dental filling is nothing but a material which replaces your damaged or decayed dental structure. It can be of any material or any kind of material out of the four kinds of material which I am going to discuss. So a dental filling essentially restores the structure, the functionality and the health of the tooth in such a way that the long-term life of the tooth is enhanced. So what are the types of fillings that are available? A lot of types of fillings are silver amalgam, which is also known as Chandika filling. Second is the composite filling, which is tooth colored filling. Third filling is the ceramic filling, which is very highly aesthetic. It is also known as porcelain filling, which is made in the lab and then it is fitted onto the tooth. And fourth is the glass ionomer filling, which is a weak filling which is used for kids and it is used for non-load bearing areas in the teeth in the adults. So now let's come to the point. Will a dental filling be painful for you? If you are getting a dental filling done for the first time and you don't know and you have some anxiety that a dental filling may be painful or not may be painful, let me assure you that a dental filling is not painful by itself normally and generally. So but sometimes the dental filling may be deep because the cavity is deep. The dental filling need to be put in a deeper area of the tooth and that may cause some pain. So depends on how the dentist is managing your filling and how the procedure goes in for you. It depends on all that. So how can a dental filling not be painful? I'll cover all that part. So firstly, to make your dental filling painless, what I do in my dental clinic I'll share with you. Generally me and my other three doctors at O Dental Clinic, what we do is we use anesthesia. Local anesthesia generally helps in giving relief to the tooth and the filling can be done peacefully. And while excavating the decay which is left in the tooth, which has to be removed, sometimes pinpoint decay is there which has to be removed completely, otherwise the decay will spread inside the tooth and it will go to the pulp. And if it goes deep inside the pulp, it may have to go for a root canal. So if I don't remove all the decay later on, after putting the filling after a month, after 6 months, the decay may increase and it may go into a root canal. So I need to remove all the decay. And sometimes because I remove the decay which is near the pulp or near the nerve of the tooth becomes sensitive. So in such cases, anesthesia is given first, local anesthesia, and then we do the excavation of all the caries is removed. So that patient doesn't feel a thing. It is totally painless and pain free. Second thing, what we can do is we use for after anesthesia we use the second thing which is known as rubber dam. Rubber dam is used for isolation, which makes the oral contamination with the saliva very unlikely, and the filling is done in a very pain-free way. Third thing that is done is sedation. Sedation technique is also used in kids. It can be used in adults also. By giving inhalation sedation, the patient is awake but slightly in a sedative state. So the filling is done peacefully and patient doesn't feel any pain. Other techniques are also there, which is laser. There are other techniques like guided meditation, music and other stuff, which also relaxation techniques are there. Breathing techniques are there, which also are very useful for the patient. So all in summary, I would like to say that for a dental filling is nothing but we are replacing the broken or damaged or decayed portion of the tooth, and we like to replace it with a filling can be silver filling, composite filling, ceramic filling, or glass ionomer filling, any of the four fillings. Mostly these days composite filling is done because it is white in color, resembles the tooth very much, and it is highly aesthetic. So front tooth, back tooth, everywhere it can be done. Only if the filling is very big, cavity is big, the composite filling is not done, then ceramic fillings are done, or a crown can be done, a cap can be done. So you have to essentially understand that all these things, your dentist is very well equipped with all the knowledge which is required to treat your tooth in a particular way and in a perfect way that can give you a peaceful experience and a pain-free experience. So you need to get your tooth assessed from the dentist. If at all required, he will do an X-ray, he will do a checkup, and he will blow your teeth with air blow and see. He will tap your tooth with his instrument, mouth mirror or probe, upside down. He will tap it and you see whether there is pressure, and then he checks the tooth on the side of the gum whether there is pain or not. If all these things are okay and the cavity is not very deep, then your filling, most probably composite filling, is done. Like I said, if a cavity is big, then ceramic cap or ceramic filling can be done. So get yourself checked, and I hope you found this video valuable. If you have any doubts or any experiences to share, you can put it in the comment box and I'll get back to you later on. Thank you very much. This is Dr. Amit signing off. Thank you.